Here's Dr. Jan Mensink with answers to your common medical questions.
I'm Dr. Mensink from the practice. I thought we'd talk about heartburn for a bit because we have a lot of patients come in with heartburn symptoms. First of all, it's important to remember the heartburn really means that it's not from the heart, and it's this burning or heaviness or pressure in the chest. It can go up into the throat or jaw, and it can be radiated much the same way as a heart attack. I.e., you need to make sure this is not due to the heart. Now here's the neat thing, a lot of people don't realize, but the innervation of the esophagus, where all heartburn comes from, is from inflammation of the esophagus or the gastroesophageal junction. The innervation is the vagus nerve, the same as the innervation from the heart. So that's why it can feel like a heart attack. So the issue first thing with heartburn, is it heartburn or is it really an atypical angina from the heart? Several things are important. If you're having heartburn and you see the doctor while you're having that heartburn episode, and he does an electrocardiogram, an EKG, while you're having that same pain and discomfort, and your EKG is totally normal, that is very good evidence that this is not from the heart, but it's really the esophagus. Several things can occur to make the heartburn occur. First of all, just rawness, or what we call acid reflux. So if you eat certain kind of foods, or you have a hiatal hernia, which makes the acid reflux into the esophagus, it can cause irritation. By the way, you don't want to have that go on for too many years because it can present with what's called Barrett's esophagitis, which can literally turn into cancer. So it's not something you forget about, all right? Acutely, it's rare to cause cancer, but many, many years, there's issues that need to be looked at. The other thing that needs to be done is, what do you do for the heartburn? All right, what can you do at home? First of all, if you're sure that this is not a cardiac issue, then several things. Number one, you'd want to stay away from Tums. One of the most common problems people do with heartburn, and the same thing true with even epigastric pain from ulcers or gastritis. Tums, it works, it's perfect, it instantly makes it go away. What very few people understand who are not physicians, Tums, all right, is calcium carbonate. Calcium is the most potent stimulator of the hormone serum gastrin that makes more acid 3 days down the road. So if you take Tums, you're just making it go away right away, but down the road making it worse and worse. So the first thing you don't want to do is no Tums. Now let's talk about what you do. Liquid Maalox and Melanta 2 are good. For traveling, Maalox or Melanta 2 capsules and little pills are good. They're cheap and work well. Over-the-counter acid suppression medicines, everything from omeprazole, Pepcid, Nexium that's now over-the-counter, work. Here's the thing with them. If you take them and it does not go away, especially after about 3 or 4 days, you need to be checked by a physician to see, is that what's going on? Because other things can cause the same thing. For instance, you can have spasm of the esophagus that could be giving you pain and feel like heartburn. You can get reflux, we've talked about. You can get anatomical abnormalities that can cause spasm or reflux or issues that have to be differentiated. And that's where a doctor has to look at to make sure that you don't have something like esophageal cancer or achalasia or some of these real rare diseases. Heartburn, usually if it's been checked by a doctor and it's not felt to be a cardiac issue, is very safe to treat at home. The biggest issue is if you have reflux, what are some simple things you can do for reflux? And the most simple thing you can do, if a doctor has diagnosed gastroesophageal reflux, is raise the head of your bed 4 to 6 inches. So you're kind of sliding off the bed. If your partner can stand it, it actually shows that, the studies show that it decreases the risk of heartburn. Now, here's the problem that people say, oh, we tell them to do that. No problem, doc, I'll do it. They go home and they instead lay the bed flat, prop themselves up on 2 or 3 pillows. So they're like this. The studies show that actually makes the heartburn worse. So you have to be not sleeping flat, but on a tilt. So your body's flat, not propped up under pillows, all right? And those are simple ways that you can do for heartburn, and it works well. Some people have asked about baking soda and a glass of water. Baking soda with a glass of water works well, and there's very little downside to it. The only issue is if you use it an awful lot, there's some alkalinization problems that can occur. but really it's not that usually a serious issue for people.